Virus infections rate has crossed the WHO high-risk limit of 10% for the first time since the government lifted the nationwide curfew of October 20th. And today the country has recorded its first cases of the Omicron coronavirus variant. And tonight I'll be speaking to National COVID-19 Vaccines Task Force Chair, Dr. Willis Awale, on the trajectory the government plans to take in light of this recent developments. Many thanks for joining us, Dr. Awale. Let's begin with the fact that Kenya has detected at least 3 cases of the Omicron variant today. We understand from the Ministry of Health that these were travelers, but what do we know about these persons? Are they vaccinated or unvaccinated persons?
Yeah, let me start. Thank you for that question, and let me start by saying that I don't have the full details, but what is most important for the time being is that we have detected the Omicron virus. It was a matter of when and not if, especially considering that the world is now a global village with all the technology on travel. Somebody with Omicron in Australia can be here tomorrow morning. So for us, I think what is important is that this is just a variant. We are reaching out to other countries to understand it more. It's a new variant, but what we know, it is highly transmissible. The scientists measure that by something called the R0 ratio, and so far it is 0.19, meaning 10 people can actually infect 19 more people. 10 people will infect 19 people, basically meaning it will always be doubling. So it's very likely it will become the dominant variant globally. And this, for us, therefore, is a warning that we must get back to the basics.
And in terms of the push by the government to have persons vaccinated, do we know whether people that are fully vaccinated are protected from this variant?
Yeah, the information we have received globally is that the people who are fully vaccinated, it is protecting them. It's protecting. The protection is not as effective with the number of doses that have been issued. We have seen reports of reduced protection even with 2 doses. And therefore, that starts pointing to the need of booster doses, which is something now the Ministry of Health is given priority. And we will be pronouncing the measures towards booster doses in the coming few days.
Yes, and there was some reluctance towards giving booster doses, but with now this lacking reality of Omicron getting into the country, what plans are there in terms of booster shots, and who will be the high priority groups?
Yes, so that, as I've said, that has been given a priority. We've brought this to the attention of the Kenya National Immunization Technical Advisory Group. We are setting out the priority groups who should really be prioritized for booster doses, how many doses, the issue of whether there should be, you continue with the same vaccine or you can take a different vaccine. These are technical issues that we are fleshing out in the next few days, and then we should give clear guidance to that.
Yes, because actually in terms of the vaccines, depending on what vaccine somebody has taken, would then that mean that they're getting different booster shots for the particular vaccine that they took?
That is a question we've asked the experts to guide us before we make a statement about that.
And the government had a target of 10 million persons to be vaccinated by end of December. Where are we now? Will we have reached that target by end of December this year?
We've made good progress, and I must thank Kenyans, especially in the last 2 weeks. If you look at our data yesterday, we did a record close to 145,000 vaccination on a single day. We had always projected we could do actually up to 150,000. So very good progress, and the whole of last week, except for the weekend, we were doing over 100,000 each single day. So now we have about 15 days to go, and we are at about 8.4 million vaccinations now. So if we do 100,000 per day for the next 15 days, you can see we will hit that target. So, and we really are going to do everything possible to reach that target. First and foremost, because it is so important that people get vaccinated. It is the best protection when we are facing all these challenges with variants that are coming. This is the time to get the elderly people vaccinated. We are heading to a festive season. People are going to travel. It is so important that as people go to the rural home to meet their parents, they must ask them to get vaccinated first.
And talking about these rural areas, there's been a lot of resistance. Reports indicate that in certain counties, there is a lot of resistance. Is that factual? And in what counties are we facing most resistance in terms of uptake?
Yeah, so we've done quite a number of studies. We've been working with partners. They have looked at various aspects. The issue of hesitancy, first, one of the factors was just the geographical reach, the access, which we are now addressing. You can see us going to the market centers. You are seeing a lot of bus stop. Vaccination is now going to very many places, and our partnership with the religious leaders, that has helped. Yes, we have a small population. Not very many people are, there are those who are just complacent. They are the complacent ones, like I've seen on the screen now, who are just saying, yeah, I know it is dangerous, but I've not got the disease yet. Yet, a vaccine is not a treatment. It is to protect you. You need that protection in good advance. Now, we know that the vaccination rates, especially in Western and Nyanza, have remained low despite high population density. And a lot of that are to do with misinformation, disinformation, and misconception, especially around the issue of fertility, which has nothing. These vaccines have been shown not to have any impact on fertility. So we are still also going on with our awareness, educative campaigns to really tell people the danger about this disease and why they must really be vaccinated. And let me actually mention something. The socioeconomic impact of this disease is severe. People may not know it, but at the Ministry of Health, we get a lot of reports about this. For example, let me just give one. A week or two ago, we get a couple where the man had refused vaccination while the wife had accepted. The man got infected, and he has accrued a bill of 2 million Kenya shillings. Now, they are seeking the ministry to help them get a waiver. Yet, this is somebody who would have not been hospitalized had they gotten vaccinated. So the economic impact, the socioeconomic impact of this disease is dire. And it will be so important for Kenyans to show up for vaccination. So
in terms of the government's campaign messaging and the engagement of local community, aside from the churches, what exactly is the government doing to create awareness in the areas where, like you said, there's complacency?
Yeah, so you may have seen today the Cabinet Secretary, Mutahi Kagwe, was meeting with the Council of Governors. We are really enlisting the counties because really they are responsible for populations, the communities living around them. Our plan is to appoint what we want to call local champions, people who are going to be able to talk. They are accepted, they are known, they are able to pass that message. The other thing we are doing, you'll start hearing us a lot more on local radio station, especially the vernacular radio stations, really trying to pass this message as strongly as we can. We are also trying to partner with the telecommunication companies so that messages can really go out, especially during the festive season. So you are going to see even a heightened more campaign in the coming few days.
And we're heading into the festive season now, Daktari, and with now this real threat of Omicron, we're seeing super spreader events being lined up. How will the government ensure that this doesn't get out of control? There's going to be a lot of travel, there's going to be a lot of mingling.
Yes, so again, let's go to the basics. Social distancing is very important. And you know, health begins at the individual level. You yourself, why should you go to a place that is so crowded and you know you are going to get infected? So there's what the government can do, but what the individual needs to do for their health is really the primary and the most important one. Do not go to those crowded places. But what the government is doing is to avail and give information. Number one, the basic measures of social distancing work. We've seen them work. Good personal hygiene, so important. So that is what we are banking on, and then have made the vaccines now available. We have enough doses to vaccinate everybody. But our end goal is that we do not want to see the country close again. We don't want a lockdown.
And I was getting to that with the reality of a surge. We know the numbers have really risen. Could there be talks around a possible lockdown, another implementation of curfew? Are we headed in that direction if the numbers continue to rise?
It is very early to say that now, but of course we will continue monitoring. We share with the country data every day. If it reaches a threshold that those measures have to be taken, they'll be taken. And that is why really we want to appeal to Kenyans. Even the information we are getting, those being admitted, like in Kiambu over the weekend, they are not had any case admitted. All the ones admitted were unvaccinated, 15 of them. So that is a pointer that vaccination works. So the only way for us to avoid that lockdown, which is very painful, we know it, we know the impact it has, is to have people turn up for vaccination.
And there was talk about vaccination of school-going children. The Omicron threat is here as of today. Schools will open in January. Are we expecting for children, at least those between 16 to 18, to be vaccinated?
Yeah, thank you for that. Actually, 15, 16, and 17-year-old are now being vaccinated. This was announced a few weeks back. We are in discussions with the Minister of Education, especially as schools open, so that we can also go to the schools to heighten that vaccination campaign. So, yes, that is in our plan.
Mm-hmm. And in the last 1 week, droves of vaccines have been brought into the country, and there's been the concern over expiry dates. We do know that in some countries right here in Africa, the expiration issue has been massive. Let's look at the shelf life. Let's just look at these vaccines individually in terms of Pfizer, Johnson & Johnson, AstraZeneca. What is the shelf life of these vaccines, and how will you, as the government, ensure that these vaccines are actually utilized?
So first and foremost, let me assure Kenyans and state that expiry and what we call on-shelf expiry, meaning the vaccine expires while still on the shelf and therefore need to get destroyed, that is not going to happen in Kenya, and I'll explain shortly as you've asked. Now, Johnson & Johnson has a shelf life of 2 years. So we have over 5 million doses of Johnson & Johnson in country now. They will expire in 2023. Pfizer had the initial expiry date of 6 months. This has gotten regulatory approval, and it is now 9 months. So even the Pfizer doses that were to expire in December have an extra 2 to 3 months, so February and March. During that time, we will have utilized all that. AstraZeneca, what we did for AstraZeneca is that now we do not allow any dose or donations that have an expiry of less than 90 days. So, and because there had been a lot of demand for second doses for AstraZeneca, the utilization is actually very high. Mm-hmm. While Moderna, again, we now just have over 500,000 doses, and many of them are being used as second doses. But what I want to tell Kenyans, there's something known as wastage. Because when you open, for example, AstraZeneca, it has to be used within 7 hours after you open the vial. So if people don't show up, then that has to be discarded. That's not an expiry, it is called a wastage. Again, with Moderna and Pfizer, once you've opened the vial, it has to be used within 30 days. So mobilization of people so that they utilize all the vials that are open is very, very critical. So there may be some wastages here and there overall, but also there are some gains, because with proper training of healthcare workers, the drawing of the vial, you could get 1 or 2 doses extra in each vial. As we stand now, Kenya has what you call a gain of about 3%. There may be a few facilities where there are losses, but there are a lot of facilities where there are gains. Mm-hmm.
And the High Court, this week's development, the High Court suspending the government order to prevent those who are not fully vaccinated from accessing government services. Is the government still going to make good its threat to disallow Kenyans who are not vaccinated from accessing these services?
I will not go into the depths of this, given now it's a legal matter, but I think it's so important. If the legal matter is around mandatory vaccination, that is not what the government is doing. What we are doing is proof of vaccination. It is important that for Kenyans to know we've gone through this path, even historically when we had smallpox. the Cabinet Secretary has powers to invoke the Public Health Act to get people to show proof of vaccination of highly infectious diseases. In the late 70s, that was a requirement. And people can read the history and find those who never showed proof of vaccination were put under quarantine. So for us, come 21st, we are putting in measures to ensure there is a smooth but very clear implementation of the measures that the Cabinet Minister of Health issued last month.
Dr. I want to forward one question to you here from one of our viewers who is saying, we know that Omicron is highly transmissible, but how serious is it? There is a flu that has been going round. So what should people look out for in terms of symptoms, in terms of just the general feeling of flu that's going around? There's a wave currently. A lot of people have been talking about it. A lot of people have experienced it. So people are not really sure what's going on. Of course, it would require you to go for a test if you think something is amiss. However, what to look out for? How serious is this Omicron?
Yeah, so I've said Omicron is new. We've now detected it. One of the things we are going to do is to try and identify it among the population. And we are keen to see those being admitted, whether it is due to Omicron. So that is a measure we are going to start. Remember, there have been very few admissions, so we will be doing genomic sequencing for those who are admitted. We will also be keen to see the impact it has on death. But like many countries, they are saying the symptoms are mild and they present just like the flu symptoms. General malaise, fatigue, muscle aches is common, and a fever. What is important is that flu and Omicron, or the coronavirus tends to attack the lung, while flu tends to be an upper respiratory tract infection. So that's a very important difference. However, it is very possible that you could have a wave of flu because they are all respiratory infection, and at the same time be having the coronavirus. The interaction of the same, whether it becomes severe, again, that is really a subject of investigations on the impact of the co-infection with both of them. But what I would want to tell Kenyans is that both of these, one of the biggest preventive measures is those public health measures. Proper hygiene, proper respiratory etiquette. Don't go spitting all over. Don't go blowing your nose all over in the air, because that is what will make these two get infected. But I think in the next week or so, we should be very clear what this bag is, whether it's influenza alone or whether it also has corona. And
final question, now that the country has crossed the WHO high-risk limit, what numbers are we likely to be looking at by Christmas and New Year? There is a surge, and there's a question coming in around the numbers and what they look like.
Yeah, so what I would say, and that is why, again, I will also end by really pleading to Kenyans to observe the measures and get vaccinated. The Delta variant, which you saw became dominant so fast, that its transmission ability was, the ratio was 0.15, meaning 15 people, 10 in fact. This is higher. So it's likely to give us more cases than even the Delta, and likely to become the predominant strain in a shorter time. So we are likely to see more cases much faster than we had with Delta, and that is why we really now must get back to do the basics.
Right. And final question. This I must forward to you. In terms of the booster shot, somebody is saying you are not so clear as regards who is eligible for the booster shots, if at all the government chooses to go that direction. For people who took, the high-risk people who took the vaccines when they first started being administered in the country, would those then be the high priority people? Would it be the elderly? Who will be first in line in terms of the booster, if at all the government goes that direction?
Yes, thank you for that. What I've said, we as a task force, we've asked the advisory group, and we've actually given like recommendation. It's our wish to see the priority groups, the frontline health workers, the elderly in particular, and people living with comorbidities. But specific guidance on when this will be implemented and how is going to come from that technical advisory group when we get the report. Yeah.
Thank you very much. We've been talking to Dr. Willis Ahwale. He is the National COVID-19 Vaccines Task Force Chair, and he's been giving us the direction the government is likely to take, particularly after today's development where the country recorded its first cases of the Omicron coronavirus variant right here, and that was from travelers who were coming in.